Hello everyone, my name is Maddie and I'm a registered nurse in Oregon. I just wanted to pop on here and talk about personal protective equipment or PPE. I am so frustrated with the current COVID situation, it's not even funny. I see people on social media, on my Facebook, on my Instagram, who aren't even working in the health field, who are quarantined at home, who aren't in their job right now, and they have access to surgical masks and N95 respirators and face shields, and they're dressing their dog up in surgical masks with gloves and toilet paper and hand sanitizer. And I'm just kind of like confused. I mean, I understand why people are terrified and they want to protect themselves, but as a healthcare professional, doctors are dying, nurses are dying, people on the front lines are dying because they don't have the appropriate access to the personal protective equipment they need. Cloth masks don't suffice. Cloth masks, there's a study that shows that cloth masks are not effective for healthcare workers. In fact, because you rewash them, because they don't have adequate filtration, they can actually increase infection rates. So those of you who think I'm going to make masks and donate them to hospitals, in theory, that's a very nice idea, but it doesn't really do much good. Yes, I will say that cloth masks are better than nothing, but they don't do justice. Surgical masks and N95 respirators, they're there for a purpose. And it frustrates me that so many civilians are hoarding these products that they don't need, products that they think that they need, just to make them more comfortable. Meanwhile, our people that are going to care for you and save you are dying. I'm frustrated. I'm sad. At my work, we have very, very limited supplies. We have hardly any face shields. I think all of our gowns are gone. We have barely any surgical masks left. We're in very, very, very short supply of PPE. I just want to take a quick minute and just think about the actions that people are doing and hoarding these supplies and how that's ultimately affecting people on the front lines, grocery store workers, nurses, doctors, truck drivers. It's scary times, people, and it's not something you want to mess with. I went up to the outside today to the grocery store and to the pharmacy. Everyone was wearing surgical masks, and I doubt half of them were healthcare workers. I bet they were just normal people who wanted to protect themselves. Yes, surgical masks can protect you. That's why they're in such high demand. But that's also why they need them in the hospitals. Cloth masks are great for regular people, for the general public, for those who are going out into the grocery store or wherever for your daily chores and your daily errands. But they're not good for healthcare workers. And I do appreciate all those people who are making the effort to, or taking the effort to make masks for healthcare workers, because yes, it's better than nothing, but it's not a solution. So my message to all of you is that there's a shortage of PPE because people are hoarding them, people are excessively buying them. And what happens when they get sick and the doctors that care for you, they don't have the means to protect themselves, and then they quit or they go in quarantine because they themselves are sick, because they can't protect you or provide for you or care for you because they don't have the necessary equipment. At my work, I've been using the same surgical mask with every single patient at my desk and everywhere I go. If I can't maintain a distance of 6 feet between me and my coworker, we're required to wear a surgical mask, but it's the same one over and over and over again. With the same patients, with different patients. Those masks are effective, but they are disposable for a reason. They're not meant to be worn over and over and over again. But the reality is that healthcare workers are suffering. And I get so frustrated when I see Instagram photos of people making bikinis out of N95 masks or underwear out of surgical masks, or pets dressed up in masks and gloves, as I said earlier. I understand you want to protect your animals, but no one will be able to care for you if healthcare workers can't even protect themselves. With that in mind, think about your actions. If you need a mask, make your own. They're fine for the general public. The CDC recommends that you wear a mask or some kind of scarf out in public to protect yourself. But they're not adequate protection for healthcare workers. As a primary care nurse, we have a responsibility to inform our patients of when it is critical to go to the emergency room. We are there before our patients even step into the emergency room, because we don't want them to be exposed to the infection rate that is present in emergency rooms and hospitals. We take care of them first. If you have any shortness of breath, difficulty breathing, to the point where you can't even walk a few steps without having to catch your breath, if you have chest pain, bluish limbs, hands, or lips, that's a time when it's necessary to seek medical attention and go to the emergency room, because that is a medical emergency if your airway is being compromised and if you cannot breathe. Thank you for watching. As of today, the United States has over 300,000 cases, over 8,000 deaths, and worldwide, there's over 1 million cases. This is just the beginning. Please take care of yourself, protect your loved ones, wash your hands, and do your part by staying home. Thank you. The following video was filmed about a week ago.
Hi everyone, I hope you're doing well. So today I want to talk a little bit about COVID-19 or the coronavirus. I know it's been a huge topic of discussion, and you've probably seen it all over the news and on social media. But it's because it's so important and it's scary. And it's a real issue that's affecting thousands of people across the globe. The United States now is number 1 in the whole entire world, which is horrifying. We used to be like number 3 or 4 or 5 or 6, and now we're like way up there with over 140,000 cases of coronavirus, and it's growing by the day. Thousands of people are getting infected, thousands of people are dying, and it's scary and it's real. So my main message to you is stay home. Protect yourself, protect your family. Only go out if it's absolutely critical, absolutely necessary. And this is because the incubation period for coronavirus is so long. It's 2 to 14 days. You may have coronavirus and not even know it. And you can be going out, interacting with others, and without even realizing it, be spreading it to other people. So do your part and stay home. Practice that social distancing. I know it's not fun. It's not easy. It can be so boring. But, that'll really ultimately help protect yourself and save the lives of others. And also, help reduce the amount of hospital beds. Hospitals and healthcare professionals are, stressed beyond the max. They're having a shortage of hospital beds. They have very limited personal protective equipment. There's hardly any masks and gloves and gowns across the country, and companies that make those products are back ordered, and it'll take months for them to get new products. So please be mindful with that. Just stay home and try not to panic buy. I know it's scary and it's a time full of anxiety, but the most that you can do is stay home right now. Limit your exposure outside and with others. Practice that hand washing, disinfect surfaces. If you do feel like you're experiencing symptoms of coronavirus, I encourage you to contact your primary care doctor or an urgent care. They can give you the best advice on what to do. If you're experiencing a cough, a fever, any shortness of breath, those are some symptoms to look out for. Also, another one that's noted is red eyes, which is kind of weird, but some people have red eyes, along with runny nose or sore throat. If you are experiencing shortness of breath or difficulty breathing to the point where you're, absolutely gasping for air and you're having chest pain, that's a time to go to the emergency room, and that's important. That's an emergency because your airway and your breathing is compromised. In nursing, we have this kind of prioritization of ABCs, airway, breathing, circulation, and if you can't breathe, that's an emergency. So if you can't breathe and you have a fever and a cough, please do go seek that care. If you have a cold or a flu or any other symptoms that may be coronavirus-like, still stay home and practice that social distancing. We had one patient call in last week who had a cough. He had shortness of breath. He had increased his albuterol dosage by a lot. His son or his children were infected, or displayed, they didn't know that they were infected per se, but they displayed symptoms of coronavirus, and they had the red eyes, they had the fever, they had a cough. So it's very, very concerning and indicative that this person and this patient had coronavirus. There was a household of six people. So 3 out of 6 in the household were displaying signs and symptoms of COVID. What was also concerning was he refused to come in and get tested, which I also understand. You don't want to come out into the community, but he refused to believe that he had COVID. He was like, nope, I don't have it. And his wife, meanwhile, is continuing to leave the house, and she's a food delivery person, so she delivers food to people. And that's scary because she may have the virus, and it might be an incubation period or whatever, and she's spreading it to other people. And so, you just need to be really, really careful. Think about others in this community and protecting others. Currently, I work at a health clinic 5 days a week, and I'm really trying to limit my exposure to seeing people. I don't want to see people because, well, of course I want to see people, but I'm not going to see people because I don't want to, in case I have it or whatever, I don't want to infect my family or friends. And I go to work. I don't have any symptoms or anything, but so knock on wood, I don't have it, but just taking that precaution and being, extra careful. I don't want to give it to anyone. And at work, we're always having to wear PPE. However, we're very short. We were only allowed to have one mask. So we get one disposable surgical mask, and we have to use that with all patients unless it gets contaminated or soiled, because we have very, very few resources. Gloves is a little bit more understandable. You don't want to use the same gloves with different patients, but we still have to be very, very mindful with the supplies and the resources that we use because we're so limited. And the gowns are very expensive. Hospital gowns, those yellow ones that you see, a pack of 5 is $200. They're expensive, and a lot of clinics and hospitals aren't able to get access to those because companies and organizations, they're back ordered, and they're unable to produce as much as the demand that we're seeking. So it's definitely very hard times. Healthcare workers in hospitals are working to the max, and so that is my main takeaway of this is it's not easy being out there and putting your life on the front lines, and I'm so grateful for all of those doctors and nurses and PAs and NPs and medical assistants and other truck drivers and grocery store workers and what are those people called? People who deliver mail, post office men, everyone who is out there working still and putting your lives at risk to make this country function and save people who are who are dying and who are ill. We wouldn't be where we are today without you. So my heart extends to everyone who is out there working tirelessly throughout this whole entire pandemic. I know we're all affected to some degree, but there's people more so than others, people who have it, people who have known people who have it, etc. To recap, I really urge you to stay home unless it's absolutely critical. Practice that social distancing. If you need to talk with your friends or get together, I urge you to use FaceTime or Skype or another type of social media interface. Really limit your exposure to only family members that live in your immediate home. Also practice hand washing, as I mentioned earlier, and get good sleep. Sleep is very important. Eat healthy, eat a well-balanced diet, drink lots of water. If you feel like you're getting a sore throat or you have a cough, make sure to drink some warm water or some warm liquids, such as, gargling with salt water or drinking, some tea or having some warm water with honey. That can help soothe the sore throat. Currently, there are no remedies or cures out there for the coronavirus. So, nothing out there will be able to cure this illness except for symptom management. So cough drops, things to make your throat feel better. And of course, if you're, having shortness of breath and it's not relieved by the use of an inhaler or, taking some deep breaths, then do go seek that emergent care from the hospital. And in that case, you would want to go to the emergency room. So with that in mind, I hope everyone is staying safe and practicing social distancing, washing your hands, drinking enough fluids, and getting in enough sleep and healthy foods. If you have any questions, please feel free to comment below or message me on Instagram. I'll be more than happy to answer your questions. Take care, and I hope you have a fabulous week. It's crazy how much this pandemic is growing in the United States alone. We're probably going to keep getting 30 to 40,000 cases every day, which is just unreal. It's mind-blowing. So thank you all so much for watching, and I hope you all take care. Bye.